My name is John Anderson. I'm a medical doctor working out of the Department of Internal Medicine at the Georgetown Public Hospital. Today, I'm pretty humbled to have been given the responsibility of being your moderator. I have with me some of the panel. I think I have two of the panelists online and the other two here in person. So I will ask the panelists to introduce themselves. I will start with the panelists online, and usually the convention is ladies before gents, and so no disrespect to the gentleman, Mr. Sidney, and I'm sure he'll agree with me to allow Cara to go first. So Cara, take it away. Tell us about yourself, please.
Thank you so much, Doctor. Good morning, everyone. It's a pleasure for me once again to have this opportunity to present and to have a conversation. I think it's very important at this Guyana Wellbeing Conference. I'm so excited for this opportunity, that this conference that I know has been just really kind of planned really quickly and put together, I think, really well. But it's really great for us to have these national conversations. My name is Cara Lord. I am a lecturer in psychology at the University of Guyana. My background is really in work in organizational psychology, so I'm an occupational psychologist, but I'm also an educator. I'm currently pursuing my doctorate in leadership and innovation, and so it's a very busy time for me, so I'm happy to be able to take some time out to have a conversation this morning on racism and mental health.
Wonderful. Sidney, good morning to you, sir. Tell us about
Good morning, Dr. Anderson. How are you?
I'm good.
Good. Yes, certainly. Nice to see that chivalry still lives and that you are bringing that. So I appreciate that. So good morning. My name is Sidney Hankerson. I am Associate Professor of Psychiatry at Columbia University in New York City. I conduct research which is focused on reducing racial disparities in mental health treatment. And I do that primarily by partnering with Black churches to try to work with pastors, ministry leaders to increase awareness about mental health, reduce stigma, and increase access to care. And I also want to say that one of my best friends' family is from Guyana, and if I were there, I would love to have some pepper pot right now as we enter this holiday season. So I'm really delighted to be here.
I can tell you the pepper pot is good this time of the year. So, look, take it from me. You know, they're cooking already. It usually is in December, but they start in November. You know, hopefully you get a chance to taste some pepper pot when you come here. So I have two lovely ladies on my left. The first lady, I can pronounce her name pretty well. The second lady, I can pronounce her first name. I will not attempt pronouncing her last name. I'll allow her to do that. And so as it works with the online panelists, I'll ask the panelists here to introduce themselves, please.
So, hello everyone. My name is Alicia Solomon. I'm a social worker attached to the Ministry of Health Mental Health Unit. And I've been working there just over 5 years. I work particularly with families of persons who would have died by suicide, and I work to help provide psychosocial support and ensure no one else in that family dies by suicide. I also work with persons who are impacted by drugs and their families as well. And I also tutor at the Guyana Georgetown School of Nursing. And I wear many other caps. So I would love to be engaged in this conversation.
Hello, I'm Dr. Lakshmi Vijayakumar. I'm from India. I'm a psychiatrist, but have been working in the field of suicide prevention for over 3 decades.
Now, I had the privilege yesterday of being in the same room with Miss Solomon, and her somber tone does not really reflect the energy and the passion that burns inside. And during this discussion, you will see some of that come forth. And so certainly we want to begin this discussion. Really, it's a very important topic. We're talking here about racism and mental health. How does racism, what are the connections between racism and mental health? How do we interrogate the fact that there is racism, and how does that impact on mental health. So I want to ask the panelists if they have a preferred order in which they would want to speak. And you can say that now.
Well, I mean, first, this is such an important topic, and it's so vast. I'm sure that we all bring very unique perspectives to the topic. I think that there is a very, very strong research base now that shows that racism and exposure to racial discrimination increases the odds of depression. And there's increasing evidence to suggest that exposure to racism and racial discrimination, especially in Black youth, increases risk for suicide risk behaviors, which we know are so relevant in Guyana and in Black youth in the United States. And so what I think how I've tried to address this is by addressing some of the structural factors of racism, and how lack of access to housing, education, jobs, policies that contribute to underinsurance among Black adults really contributes to racial disparities in depression care or mental health care. And the role of our faith-based organizations has historically been to address some of those racial injustices. And I think that as it relates to mental health, we know that more people seek help from clergy initially when they're experiencing a mental health problem than they seek care from a psychiatrist or primary care doctor. And so I have been working with clergy and churches to try to address some of the racial injustices that contribute to mental health on a more kind of structural or systemic level.
Wonderful. So any comments from the panelists or persons in the audience? He said a mouthful. Yes.
I'd be so happy to hear about how Dr. Hankerson's work with clergy has evolved and what kinds of things he's found just kind of relating to the community in such a direct way. And then I don't mind presenting after him. I just have 3 quick PowerPoint slides that I think could help to contextualize the conversation here to Guyana.
And Ms. Lord, since I didn't realize we were doing slides, and maybe this would be a good segue.
That's fine. I didn't
I'll do it.
slides.
If you don't mind, I'll show just one video that I think really hits on how we have engaged clergy and some of the racial injustices with this. So I will go ahead and, if you don't mind, you know.
Do you need time to set that up, or do you?
No, it's ready to roll. I have it ready to go.
So
okay. So I'll do that, and then I think that would be a good segue to your talk. So Dr. Anderson.
That I wanted to talk about, and I said, okay, I'll put this on a couple of slides. It's really basic, nothing too fancy. So I'll go ahead, even though I can't share screen, just to say a few things about racism and mental health, tied to mental health. So first of all, I wanted to start by just making sure that everybody has a bit of clarity and we're on the same page with where the conversation is. And I want us to be aware that racism can involve acts against a person or a group of people. And it's specific acts that are tied to issues of or experiences of discrimination, experiences of prejudice, experiences of oppression. So some of the things that you've already said, you know, in your brief remarks at the beginning of this conversation, and these can be considered as, you know, actual attacks, whether they're physical, whether they're verbal, whether we consider them to be crimes of hate, or they can be very stereotypical things. So we take it for granted, and we might say things about people, maybe not even to their face, but it comes out in the way that we treat people. And so I want us to, you know, contextualize racial discrimination really broadly, and not just thinking about whether we're verbally or physically bashing or battering somebody. It could be discriminatory acts. We quite often see that in the workplace setting. That's something that we talk about very often when we think about issues of diversity and inclusion in the workplace, when we think about equitable and fair hiring practices in the workplace. And we also think about issues tied to critical race theory and the importance of good leadership and the importance of dialogue, having a two-way conversation between people and not really talking at people and making sure that we value what their experiences are as well. So there's a really broad context as we think about racism. And as we think about racism in Guyana, just based on my experiences in Guyana and in the Caribbean, we try to downplay or maybe negate the fact that it's there, and we want to think that we are very cooperative, we get along really well, but I think there are very underlying things that affect our own personal biases, and that can be tied to our experiences with one person or a few people from a specific race, or it could just be tied to what we've been cultured into, what we've learned or heard growing up. And even though it's very difficult for us to have conversations around racism, so people tend to try not to think of themselves as a racist person, and they feel like if you term them as racist, then that's very offensive to them. So there's that stereotyping as well about who might be a racist person, and then the things that we have to think about, making sure we say the right things, making sure we do the right things, so that we're not classified or categorized as somebody or come across as somebody who might be racist. But the fact is we all have our own individual biases that are tied to issues of race, ethnicity, gender, and those kinds of issues. But we're specifically talking about racism and mental health. So what I wanted to think about was how this affects the individual, the person who has to deal with this, manage this situation of racism and mental health. And what you'll find is that where persons have pre-existing conditions, it may not necessarily be a diagnosed mental illness, but it could be issues related to their mental health and wellness. Then you'll find that those experiences can be very traumatic for them. It can worsen any existing conditions that they have. And there is something that I found in the literature called racial trauma. So it's based on your experiences of acts of racism, whether those are violent, whether those are verbal, whether those are passive aggressive, whatever they are, they can cause this experience of trauma based on how you were treated because of your ethnic background, because of your race, because of your cultural upbringing. There are also some individual personal things that we'll deal with once we've experienced racism and these acts of prejudice or discrimination, which are tied to our concerns and issues around our own self-image and our self-esteem. And this is something that I see locally quite often. People are concerned about the color of their skin and what that means and how that'll be treated, and whether or not they'll get a good job as a result of that, whether or not we'll treat them fairly, whether or not they'll have access to certain resources, whether or not they'll fit in with certain groups, whether or not they'll be able to have certain educational equality or equity based on, you know, those access kinds of issues. People are very concerned about the color of their skin and what that means for them and the quality of life that they'll be able to live and to have. And sometimes we find that because of the oppressive struggles that some racial groups will inevitably face because of a lot of things, because of colonization, because of socialization, because of cultural biases, then we find that there are people who feel backed into a corner. There's nothing else for them to do. They don't have the access they want to education. They can't afford it. They're not getting the kinds of jobs that they want to, and then they end up doing some of the things that we really want to steer them away from, regardless of what race you're a part of. And then of course there are issues that are tied to stress and anxiety that I've mentioned before, and then depression, Dr. Hankerson has mentioned. So those are some of the issues that can bubble up as a result of racism that we tend to probably overlook and just feel like, oh, I'm not doing anything that's really harmful to somebody. You could be doing something that's very detrimental. So this is my last slide. As I said, it was a really quick thing that I put together, because I find when I do slides, I tend to talk a little bit longer. And so when I considered some of the things that we can do as we think about racism and mental health, to make sure that we are protecting individuals and making sure that we're also tackling the problem on a very national community level, I thought about the importance of sensitivity and cultural awareness, and really just educating others about other cultures, other racial backgrounds, historic activities around certain ethnic and racial groups. This is something that we've considered, and there's a lot of literature around in education, just sensitivity and awareness culturally for teachers. One of the bigger issues we've had in the literature is talking about and thinking about ways that we can, one, diversify the teaching pool. So this is in the US. In Guyana, we're probably a lot less sensitive about it, but in the US, there's a lot of conversation around making sure that a class full of Black children don't always have a white teacher in front of them. And because they need somebody that they can relate to, they need somebody that they feel, understands their background and their situation. They need somebody who is sensitive about, what they've been through, what they're currently going through, and what that means for their education, for their upbringing, for their development. So there are a lot of issues around there. Of course, there are issues around how practical it is to get those teachers in the classroom, to get teachers from Black and Latino communities in the classroom, whether they're trained, whether we should engage in hiring practices that are equitable, just to make sure we get them in, instead of hiring practices that are based on merit, based on performance, based on educational background. So there are a lot of issues tied there, and those are specific to education, but we can also think about how they can be contextualized in communities and in the workplace as well. For the individual, I thought it would be a good idea to engage in anxiety and stress relief activities, whether those are around reading, whether those are around engaging in physical activities and hobbies that are meaningful and important to you. And I think mindfulness and just kind of training people about what mindfulness means and how this is practiced and exercised in your own individual lives is also a really important and key component to making sure that we are in control of ourselves, because you find that acts of racism can be very triggering to people. And if they're not kind of self-aware and have that kind of base in thinking about how to be in control of their own body and control of their own feelings and what their reactions are going to be to any stigma, stereotype, prejudice, discrimination, those kinds of things that they face, then it can be more harmful and traumatic for them as well. So I think mindfulness could be a really good way for the individual to be self-aware and be in control of their behaviors, their feelings, their attitudes. On a broader level, I think having shared activities, communities of practice, ways that we can really come together for a common purpose so that we are working together, we're learning about each other in the field in a very practical way, and we recognize that our experience with one person or a few people from a racial group does not determine or give meaning or give life to what everybody from a specific racial group is. And I think we can learn a lot from each other, where we have opportunities to not just talk with each other, but really share our experiences, really work with each other so that we learn and understand each other a lot better, and we understand what is appropriate, what is not appropriate, to see people as individuals rather than to just see people based on what the color of their skin is, how their eyes look, what their features are, or anything like that. And then nationally, I think it's really important as well for us to not just think about, but to have on paper policy and legislation that protects us against racial trauma and racial discrimination. And it makes room for activities around remediating cases where there have been breaches to people's, based on people's racial background. So those are the few things that I'll say, and I'll throw it out to the other panelists to give their remarks, and that we could probably just have an open discussion, Q&A on it.
All right, certainly, Cara, you really said a mouthful there. And there are a lot of points there that we can comment on. I see there's some comments in the chat. They're basically affirming what has been said. So certainly I want to come back to Dr. Sidney Hankerson, who wanted to share that video, and then we'll take some questions as we go on, just to get the other panelists in as well.
Yeah, thank you so much for that, Kara. I had some talking points for today that were based on slides. I didn't know how formal this was going to be, so I'll just show them briefly. I think, you going first was the perfect overview of the impact of racism, on mental health. And so I'm going to kind of expand upon your section where you talked about what we can do about it, specifically focusing on working with Black churches to promote equity. And so, my work really focuses on depression and the impact of racism on depression. And I think it's important to note that depression is the #1 cause of disability in the world. So more people worldwide have lower quality of life, are impaired, and miss time from work from depression than any other medical condition. And Black Americans with depression compared to depressed white Americans with depression have more severe depressive symptoms, are sicker for a longer period of time, and are more impaired. And so I know that oftentimes in communities of color, there's so much stigma around talking about mental health conditions and depression in particular. But it's important to know that communities of color are more impaired with depression than their white counterparts. And the impact of America, of racism, really became a focus of the world's attention 2 years ago, of course, with the murder of George Floyd. This picture actually was taken from Amsterdam, which showed the impact of George Floyd's murder and the impact of racial injustice and structural racism.
1 second, Dr. Hankerson, just keep your mouth close to your mic. We're
Oh, you
losing
can't
you
hear me.
from time
Okay.
to time.
And so
Thanks
it
so much.
really showed the impact of structural racism globally. And so, Ms. Lord just wonderfully illustrated how racism impacts mental health, specifically in Guyana. But it's important to note that when people of color are exposed to someone killed by the police, their mental health suffers. And so the impact of racial trauma that Kara so wonderfully just talked about is very real, and it appears to be more significant in communities of color than among white communities. And so that really comes into what can we do about it? And certainly in America, the role of the church has been a leader in addressing not only the spiritual needs of community members, but also the mental health and social needs. African Americans are the most religious group in the United States by this data that you see here. Overwhelming majority belong to a religious group, the majority of whom identify as Christian. 79% say that religion is important, and 53% attend church at least one time per week. So churches really are hubs for supporting folks' mental health. And so what we have done is leverage the trusted role of the church, leverage the trusted role of pastors. And we've developed a program where we have trained community healthcare workers from local churches. We recruit people from their health ministries and equip them with skills like motivational interviewing, how to screen people for depression, how to connect people to formal mental health services, all through their relationship with the church. And so I have a brief video that will highlight a pastor talking about some of the racial injustice in this country and the role that community health workers can play here, and I believe in every nation. So I think this is especially relevant in Guyana, given the important role of the church.
How you face yourself in times of unrest becomes pivotal in terms of how you see yourself. The best of who you are doesn't usually rise in moments of no challenge. The best of who you are comes to the forefront in moments of challenge, and we are in some challenging times, beloved. In those moments where we feel like our backs are against the wall, where we are bombarded on every side, where chaos and calamity become our companions, those are the moments we get to see who we really are. We're challenged on several fronts. The social unrest and injustice in this land. We are still plagued by the myth of racial superiority and white supremacy. That's one challenge, and it's a challenge that has never left our community. But on top of that, in the midst of that, we now find ourselves dealing with a plague of epic proportions, COVID-19. Life can be so overwhelming. Life can be so battering and bruising that pretty soon you feel as though chaos and calamity are your constant companions. Darkness begins to creep into your conscience. And with darkness comes those feelings of destruction, and the toxicity that runs rampant in your spirit can be so overwhelming. And in the midst of feeling overwhelmed, one day you look around and you look at your life and survey the landscape of your life, and you feel as though you are all by yourself.
You don't want people to look at you differently or begin to judge you in a certain way.
All by yourself. All by yourself.
Sometimes I feel like I'm preaching to myself.
My bouts with depression started in part because of my chronic health condition. I was born with a very rare disease known as common variable immunodeficiency. In a word, I was born with no antibodies. I've been a pastor, battling sickness, battling this disease, battling chronic pain, and still having to show up for people and preach and minister and teach. The truth is, I don't know or remember of a week in my life where I did not have pain. But I remember hearing someone ask one time, what happens when the comforter needs comfort? What happens when the one who is always expected to show up for everyone else needs someone to show up?
Depression is a clinical condition that is the #1 cause of disability in the world. It's also the #1 cause of disability in New York City. So our team conducted the first ever study where we identified people with depression in the church. We worked with 3 different churches, one in Harlem, one in Brooklyn, and one in Queens. And across these 3 churches, where we screened over 100 people, 20%, 1 out of 5 people at these 3 churches had depression.
One of the things that Dr. Hankerson and I have done is that we have created a community health worker training institute, or center rather, at Columbia University.
My name is Calvin Martin. I'm a community health worker. I was trained by Columbia University Medical Center, which is a part of New York Presbyterian Hospital. The training was long and intense. It was an 8 weeks training course, 3 days a week, 2 to 3 hours per day.
The role of the church in the Black community has historical significance. It has been a place of solace, comfort, a place for guidance and spiritual wellness for generations.
Over 70% of African Americans attend church regularly. And this community health worker training center that we have is responsible for working directly with health ministries in the Black church and imparting skills and knowledge around different health screening activities, around different health counseling activities, and even around the enrollment of congregants into health insurance plans.
What they've been able to do is Columbia and with community health workers are form a network of support and care and concern that's been able to help countless people. But we cannot afford to remain silent. We cannot afford to remain embarrassed. We must seek out the services that are available from the institutions that are committed, but are committed to the healing that is necessary to keep my mind right, and my heart right, and my spirit right, and my soul right.
So I'll stop sharing, and I think that video really captures what we're trying to do to follow up with Kara's point about this issue. And the last thing I'll leave you with is we were very intentional in naming this study Triumph, which stands for Transforming Your Mental Health Through Prayer and Healing. We know that oftentimes in the Black community, we kind of split mental health into either you pray about it, or you go to your spiritual leader, or you seek a mental health professional. And then that can cause a tremendous divide in our community because they think that you have to do one or either of those two things. And so by emphasizing prayer and healing, we wanted to just really emphasize the fact that you need to do both in integrating those spiritual practices that are so important, as well as, when necessary, seeking professional mental health care. So with that, I'll turn it over to our other panelists.
Thank you, Dr. Hankerson. All right.
All right. So as Cara shared her presentation, I was forced to draw on my own experience with, one, being a professional, and two, working in an environment as a Black professional in Guyana. And one of the things that I want to note is that as we tend to look and have this conversation about racism and mental health, in Guyana, we don't want to have the conversation. We don't want to talk about racism because we're afraid to be called a racist. We're afraid to be associated with being a racist. So we don't want to have the conversation. And when I talk about drawing on my own experience, I remember started out working as a social worker in a non-governmental organization. And I was there at that time. It was not the thing to do, go natural or wear your natural hair. It was not so prevalent. And I was wearing my natural hair. I was wrapping my ear sometimes. I was dressing with African attires. I would wrap my ear. I would do me African. And I remember one day I went into work with my head wrapped, and my director at that time, she said, "Miss Solomon, can I have a word with you?" And I said, "Okay." So I went into her office and she asked me, "Is something wrong with your hair?" I said, "No." "So why would you wrap it?" I said, "Because I feel like wrapping my hair today, and that is something I would do from time to time. But when you came to the interview, your hair wasn't wrapped. So why would you wear it like that?" I said, "Because that is how I feel like today. I feel like wrapping my hair." "Well, I wouldn't have you come back to work with your hair like that." At that time, I said, "Okay." And I walked out. To this day, I've never had this conversation with no one else. I remember going back to my supervisor at the time, and I told her I need some time and I'm going to take some time off. I left the office. I went and I processed all that was said to me. And the next day I came back with my hair loosed out and it was in Afro. We had another conversation about my Afro. I said to my supervisor, I said, at the end of this project, I don't want to work here again because my hair is not doing the work. I am. And if my work is being done, why should my hair have a problem? Why should you have a problem with my hair? And it is until now that I'm able to look back and say to myself that, Alicia, you didn't even check in with yourself. You just address it as okay. And so you didn't take time out to look at your own mental health, one. And two, you didn't want to be a part of that conversation that should have stood up for yourself as a person, an African person, wearing your natural hair. And I can share on so many other experiences I had where I was called a Black woman and a Black, all the other words. And we don't, because mental health is such a new conversation that we're having in Guyana, sometimes we don't want to, even as a professional, we don't want to let people know that I am suffering because this has happened to me. And with this conversation, I really wanted to be a part of this conversation to really hear. And Cara would have spoke about how we sometimes don't want any association. We don't want to be a part of. And so being a part of this conversation helps me to understand this is not only a problem in Guyana, but here in America, we're having the similar problem or even worse. And so the problem is not only for us here, but it's a worldwide problem. And I have learned to embrace my Blackness, my Africanness, in terms of speaking out now that I have the knowledge about mental health, one, and two, that understanding that this is a conversation that is necessary and that we need to talk about not only racism, but our mental health as Black people, as persons who work in the field of mental health. And how do we address mental health? By addressing mindfulness, being mindful of who we are as persons who are are Black and who are in this fight and to help persons address mental health. We need policies that will help persons who are impacted, one, and who are involved in meeting out and treating people differently because of the color of their skin or because of their association. I don't think it's fair for us to continue or to leave this conference without not changing the narrative. We need to change the narrative of how we treat, how we talk, how we have these conversations, and not to be afraid of having the conversation. All right. And so that is what I wanted to share. I want to have the conversation. Anybody who's willing to have the conversation, I'm willing to be a part of the conversation, be a part of the change that we want to see. And so I'm willing to stand and to be a part of that change and to really share my experience and to really move towards policy change and inform policies that will help persons not only to embrace racism, but to embrace their mental health and promote healthy mental health. Thank you for that.
Thank you. Yes, thank you very much. Full disclosure, I opted for last because I have not really worked on racism, but as my panelists, we have all experienced racism in our own ways. And it has really permeated into the society. Just to take from what she spoke about, it is not fair to be treated like this. Why should the word fair come there? Where did the notion come that fair is good, fair is correct, fair is balanced? Why should we say it is not fair? It's not right is good, but we all say it's fair. So it is really permeated into our language. And we have to start from there, I feel, because our language has connotations which are completely unequal. Okay. And I think we have to change the way we speak, the way we talk. But apart from that, I think we as human beings have the wrong connotations about color. Okay. Color is something which is just a stupid pigment on the skin. Okay. But the amount of attachment we give to that is incredible. In India, probably more than racism, I would say casteism plays a huge role. So when we started the Vedic society, when it started, people were divided according to the professions. The Brahmins, who are supposed to preach and pray for everybody, the Kshatriyas, who protect, and the warriors, the Vaisyas, who are traders, who do trading, and the Shudras, who are the people who work, who are the day laborers. So it was by profession, but somewhere it changed into where you're born. And that structured the whole society. And it is incredible that even today, if you take up a Hindu paper or an Indian national paper on Sundays, where they search for brides and grooms, all the castes and the subcastes, we want a tall, beautiful girl from this caste. You know, that is what happens. And I have never ever seen one single advertisement which says, I want a beautiful black girl. It's always tall, fair girl, which everybody wants. Okay. And if you are describing a girl who is a bit on the darker side, you will say wheatish complexion. What is wheatish complexion? Okay. So that is how it is mired into into the language, the community, and the system. Now, the fact is, even today, if you look at it, in many countries, I've seen fair and lovely cranes, okay, to make you look fairer. Yeah. So why are we looking for something which we are not? As she rightly said, why don't we embrace what we are? We are all different. There is no, all our fingers are different. Like that, we have different colors in our human beings, and that's it. And instead of accepting that, we have always looked at fairness, whiteness as something superior, and that's where the problem comes. And it is the way it is being treated as, I don't want to go because people have already talked about the structural discrimination and the everyday discrimination. So I'm not an expert in that, but I am a practical person. Okay. The fact is, it is an unequal word. In an equal word, we won't have this panel, right? If in a completely equal word, will we be having this panel? No, we won't. So it is an unequal word. Okay. So how do I navigate and survive in this unequal word? Okay. Either I can become angry and bitter, and see, even in India, I am considered black because the people from the north are white. वो गोरे वाले हैं, एक काले वाले हैं. गोरे वाले is fair people, we are the dark people. You know, so how do I navigate this? Okay, I can be angry, I can keep fighting, I can become miserable, but ultimately I'm the one who is suffering because I am disturbed by everything that is happening. I am disturbed by my slights, I am disturbed by my discrimination. So how do I handle myself and the society? The one way to handle myself is what I think you Westerners, Western psychologists call as dispositional forgiveness. Okay, it is not discounting what happens to you. It is not ignoring what is happening to you. It is not accepting what is happening to you, but reframing what is happening to you. Reframe what happens to you, and when you reframe what happens to you, then you feel more accepting of yourself. So when you accept yourself more, you accept others better. And that's the route which I follow when I face discrimination at any level. Okay. And I particularly want to congratulate the doctor on the involving the Black church. We have similar programs in India, which we call as Dawa Dua program, where, we have a lot of places in India where people with mental illnesses feel that going to that particular dargah, that particular temple, and leaving the mentally ill people there for 14 days or 15 days would cure them and things like that. So people with mental ill, people sometimes are chained and left there. So there are places where dargah where people go with mental health illnesses to pray. Okay, so along with the imams, along with the priests, we work, and it's called Dawa Dua. Dua is a pill and prayer thing. So inside the dargah itself, we will have a mental health professional who will be there, and we educate the imams, and if they, for mild common mental health problems, they deal with it. When it comes to severe mental health problem, the mullah will say, please go to the next room and take those tablets and Allah will make you better. Okay, so the patients come there, take the medicines, and regularly they keep following up. And these programs have been extremely successful. In my personal own effort, I work with a lot of people practicing alternate system of medicines and faith healers, people practicing Ayurveda, Siddha, homeopathy, and people with faith healers. And we conduct regular programs on how they can handle the common mental health problems, because we have found in our research that 63% of people who have emerging mental health issues go to these people before coming to a modern mental health retreat. So equipping them, making partnership with them is extremely crucial to address mental health gap and issues. And as I said, I hope we will have a world in which we don't have this kind of panel.
Wonderful. These are pretty good presentation from our panelists, and I want to say thank you very much. So I want now to open for discussion, and excellent. So we had one hand raised here and then the other.
Pleasant good morning to each and every one of you, those who are present in person and those who are online. I was moved to add to this conversation because of what you said. But before I add very briefly, a quick question. Are you wearing your own hair? Anyways, just to think about it in the sense that you made in your presentation that you are made to feel insignificant because of embracing the African spirit in you. And you were made to feel insignificant. And coming out from what you're saying, so I noticed you looked at, you know, like, why am I saying this here? This is the problem we have in our society. And as I agree with Dr. Lakshmi, that I'm a practical person. And I believe whenever you're going to approach something, you have to approach it from a pragmatic standpoint. And I'm happy with what the doctor would have mentioned with his approach, or with the new approach on what you call the concoction of science and spirituality, using your faith and medicine to heal yourself when it comes to mental health issues. But quickly, I wish to add, the reason why I have seen, as a person in the behavioral science, why the Black community, and this is just my opinion, and I mean no offense by saying this is just my opinion based on my analysis, that the Black community has such a great disparity. It is because we have seen the role of the church. The role of the church, or the role the church has played in moving our African ancestors from physical slavery to mental slavery. We have seen it in the Indo-Hindu community. And Dr. Lakshmi mentioned it, where the system, society was divided based on your profession and not the color of your skin. But the colonizers came now and caused it to be moved from class to class, where you were classified by the color of your skin. Now, if we're going to really talk about issues, we need to be pragmatic and take more of a pragmatic approach. But I like what Dr. Sylvia, her name is? Okay, I love her presentation, and she has really touched on the essence of what obtains here in Guyana and the Caribbean, because we become so fixated. We become so fixated on not wanting to be labeled as a racist. We shy away from adding to the conversation. Well, I am this here. I believe controversy matters. And in order for you to really, truly get your point and add to the discussion, you have to be able to appreciate the differences of opinions and to withstand, while withstanding the differences of opinions, stand your ground based on your convictions. Thank you.
That was a beautiful note to end on. Hence, it's comment on. Happen to be my friend as well. I have some friends in the audience. That's my disclosure. I do have some friends. But there is a question online, and it doesn't really speak to racism, or it may. This is from. All right. So we'll come back to that question. So it was up, and then our technical people will sort that out. All right. So do you want to comment, or does any of the panelists want to comment to what the gentleman just said? Is there any other? Yes. All right. So we'll take the question now from, as he approaches, we'll take the question from Mansfield. Maritza Mansfield. The question is, can peer pressure lead to mental health issues? And any of the panelists can take a shot at that. I'll repeat the question. Can peer pressure...
Oh, I heard.
Okay, so Dr. Lord was clarifying the question in the chat, just to make sure that we're understanding clearly what Mansfield is saying to us, or trying
Yeah,
to...
so I saw the question in the chat. I've been really busy trying to make sure that I respond to people in the chat and in the Q&A. And I wasn't sure if we were talking about pressure in terms of like around stress and anxiety, or if we're talking about pressure in terms of those that we consider our friends or our peers or our colleagues. I think of issues that are tied to our mental health and wellness to be very individual issues. So a lot of it does depend on our own socialization, our own experiences of situations, or on experiences of trauma, stressful situations, situations where violence, those kinds of things occur. There are also determinant factors that are based on genetics and heredity and biological kinds of things that affect the way that we are individually and personally able to handle, cope, the way we're resilient to issues that are tied to mental health and wellness. I think peer pressure can contribute. It's a very general question, and it really does depend on what the scenario and the situation is, you know, what the mental state of that person is as well, you know, how they feel in that scenario, how individual they are to, you know, weigh in and give their own perspective and make decisions for themselves and those kinds of things. And I think that that's a whole other conversation that we can have. So I hope that brief response helps in some way. I wanted to just make two comments quickly on two things.
Before you go on, Dr. Lord,
Sorry.
One quick housekeeping issue. Dr. Sylvia Mazula, you're in the wrong room. They're waiting on you in room 5. This is room 1. We're not casting you out. We'd love to have you stay, but there's fun happening in room 5, and you're missing. Okay, that was quick.
I was wondering what was going on. Okay.
We were wondering too.
Thank you. Okay, bye.
I put the meeting ID in the chat.
Thank you.
Wonderful. All right. Yes. So, Dr. Lord, you were wrapping up your response. Go ahead, please.
Yes, it's Miss Lord. I just wanted to respond to, I think one of the panelists had mentioned the concept of fairness, and another one of the panelists picked up this concept and talked around it a little bit, and I wasn't too sure what the issue with the concept was. And so I'd really like for her to comment on that a little bit more, because I think just thinking about fairness is a really broad thing that we can talk about. Again, it's very subjective, I know, but I think really if we have a perception about how we're treated as a human being, as an individual, and we feel like that's not fair, then there's nothing wrong with us indicating that that's how we feel about it. And that's generally, you know, what people will do in any context, in any situation, whether they feel like they're being discriminated against, whether they feel like your words are inappropriate to them, or, you know, whatever the situation is. So I'm wondering about some more of your thoughts around the issue with this concept of fairness, and whether or not it is more tied to a move of having a discussion around equality and equity, which I think really wraps up the concept of fairness in it as it is as well. And it's still very subjective to some groups, something that we think might be fair. So one of the conversations I was having in the chat was around the way that we treat and work with Indigenous communities, and whether we are biased towards them, whether we are disenfranchising them, whether we marginalize them. So there's a conversation that came up in the chat and something that I wanted to talk about, but we have very limited time. And of course, there are issues around what our thoughts are about how fairly we work with these communities, what resources they have access to, the fact that many of them are remote, and there are issues of fairness there. So if we give preferential treatment to them, that might seem fair to them, but that might seem unfair to people from a different community who feel like they need this kind of preferential treatment. They need XYZ access to resources. So it's a big conversation. I don't think that we should shy away from the term of what fairness means to us as an individual, as a group, as a community, and as a nation. So I'd really love to hear some more comments around that.
Thank you, Ms. Lord. So just in terms of where we are with with regard to time, we have just gone over our 50-minute time period, and we're kind of approaching the 1 hour mark. So I want to give the gentleman a chance to ask his question.
Good day, everyone. It's not much of it's not a question at all. I wanted to add some comments to the discussion. I'm a counseling psychologist, and in my practice, one of the issues that I see raised among people suffering, living with depression and anxiety is this struggle with racism and colorism. So for example, if I am the dark-skinned child growing up in a family of light-skinned people, I feel, I perceive that I am seen as different and treated differently, and that creates some challenges, which very often morphs into mental health issues later on. And I'm solutions oriented, and so when I was given the opportunity to do some work on diversity awareness around the country, I traveled to 8 of the 7 regions, and I spoke mainly with community leaders there, and I was able to find some interesting things. One is that very often in Guyana, we blame racism on politics. It seemed to me, though, based on the little bit of research that I did, that it was not caused by politics. It was exacerbated by politics, exploited by politicians, but it was not caused by politics. I felt that it was, it came out of our own personal biases, which very often we don't realize that we have. So if we were to all examine ourselves, we would realize that we all have biases against people whom we perceive to be other. And in addition to that, our racism tends to be fueled by fear of anything that we don't understand, fear of anything that seems to be different from us. And one of the things that I try to encourage the participants of those workshops that we did to do was to examine your own biases, one, and then be intentional about learning, having conversations with people whom you perceive to be different. And one of the things that we found was that, I'm sure I'm not giving new information here, but one of the things that we found was that we were so much more similar than we were different. And once we're able to come to that realization, then it helps us remove some of those biases that we have. I'm going to stop there because it's a lot.
All right, notwithstanding the pressing issue of time, I still want to give an opportunity for probably one last comment, question from the audience, from the online audience, and from our in-person audience. All right, so there's some talk going on in the chat, which is good. Dr. Ms. Lord is clarifying with the person who asked the question, so that takes care of that. Okay, I want to ask the panelists as well. Do you want to summarize your presentation for us in probably 1 or 2 lines, starting now with the?
I think it does. No, I think it's time we have this conversation in every forum.
I will share the same sentiment. It's not to attack anyone, but it's for us to have the conversation and have it in a neutral way and understand that we're more same than different.
Yes, Ms. Lord, summary of your presentation in a line or 2.
Yeah, thank you so much. I'm happy to have had the opportunity this morning to talk about issues around race and mental health. Race, in particular for me, is an issue that I can get quite emotional about. I want to encourage us to be very thoughtful and mindful about the way that we talk to, work with, treat, deal each other, and to make sure that those interactions are based on who we are as individuals, as people, as human beings, and not who we are as whatever we want to, however we identify ourselves or the way that we look. So thank you.
And the gentleman gets to close things off. Go ahead, Dr. Sidney.
Thank you, Dr. Anderson. I just want to say it's been a pleasure to be a part of this conversation. And I just echo everyone's sentiments that it's so important to have these conversations about mental health. And the reality is that systems of oppression exist in every country of the world. And so it's important to understand how they are both similar and different based on the local context. And I look forward to future conversations.
Beautiful. I look forward to future conversations myself. Certainly this engagement is a step in the right direction. Steps were made before, and we are continuing that vein where we're engaging this issue of racism. We are moving from that place of denial to acceptance, and then to open interrogation of the topic. And it has significant implications for our people in every part of the world. And I'm sure each person in this room has a story to tell. And I think we need to deliberately continue to push this button. And I think we have the right people to do that. And so I want to say thank you very much for coming to this session. And thanks to the panelists and thanks to the audience. Have a good rest of your morning.